So I'm going to go ahead and move into another case here. Now, this one's titled MVC Needs to Pee. I don't know about you guys, but I'm always seeing these patients who they're trauma patients, they're on the board, and they can't focus on anything you're saying to them because they need to go to the bathroom. So this was no much different. She's a 20-year-old female. She comes in after a motor vehicle crash. She's anxious, kind of scared after this whole crash, but she didn't really have any pain. She got out of the car on her own. She was ambulatory on scene. Her vitals are normal, and we don't really see much on her primary survey, but she's kind of distracted. She has to pee. She's anxious, so who knows? I'll just throw in, this is not uncommon, and I'm sure this is like this where you might work. There's 5 other trauma patients, and there's a stroke patient, and they're all waiting in line to go to one of our CAT scanners, and so it's getting busy, and so we got to triage these people and decide who should go to CAT scan first and who can wait. Oh, and by the way, lots of trauma patients just came in, so the nursing staff is kind of stressed. There's not enough of them, and this patient looks good. Do we need to start IVs in her? Do we need to draw labs? She needs to go to the bathroom. Can she just get up? You need to answer that question. The nurses want to know. So, but she is a trauma patient. She had a good mechanism injury, pretty high speed MVC. So we're going to go ahead and do our primary survey, trauma workup, and that's going to include a FAST exam. So start off, and one of the first abnormal things we see here, we're somewhere on the left side. This looks like the tip of the spleen, and there's definitely some fluid in her abdomen here. So that kind of raises your eyebrow a little bit, like maybe there is more going on. So let's keep going, and we see a little more fluid there in the abdomen. So maybe a little bit of fluid here in this pericardial gutter here on the left. And then I'm going to stop there for a second and take a look. It's not the left anymore, but in trauma patients sometimes you forget the labels. And so here's her bladder, right? This is probably the lower part of the cervix and rectum, but it looks pretty clear here. There's no fluid behind her bladder, so that looks pretty good. But then we scan up through this towards the fundus of her uterus, and we see in her pelvis here, again, ignore this left marker, we definitely see some fluid in this patient's pelvis. And this is one good lesson in the female trauma patient. You have to find the uterus and look behind the uterus for fluid, because the fluid doesn't go behind the bladder, it goes behind the uterus, pouch of Douglas. And then we look at a few more things. There was a very terrible image of her heart, and this is the left side again. So another kind of key point is always pay attention to the whole spleen. It's pretty easy to see the whole thing in one big swipe or two. This is down around the spleen tip on the left, and this looks kind of too big for the tip of the spleen. It's a little bit heterogeneous, a little bright here, a little darker here, and more gray, a little less echogenic here. So this is kind of heterogeneous, too big. So this is a clue that there might be something going on, maybe an injury in this spleen. Not real specific, but something you can usually pick up. And then that part looks pretty good. There's not much going on here. And then here we're back. We just scanned through the bladder, and again we're towards the uterine fundus. We see again fluid in this patient's pelvis. And then right here towards the end, take a look at this. This is again right around the pelvis. We've just scanned up through the bladder and the uterus. And what we see here is we see intestine. So if you remember anything else from this case, it's anytime you see intestine on a FAST exam, start looking closer, because there's probably some fluid there that's making that intestine more visible. Because usually we can't really see the outlines of intestine on a FAST exam. But we definitely see intestine that is outlined with fluid here in this patient's pelvis. So because of this FAST exam, of course, we kind of move her up the triage list, and we start treating her a little bit more aggressively. We go ahead and say, yes, she needs 2 large bore IVs. No, she can't go to the bathroom. And yes, she should probably go to CAT scan before some of these other trauma patients who are stable that have negative FAST exams. And she was actually found to have a grade 3 spleen lac, still some active extravasation, and she had to have endovascular therapy. And she eventually did well, and she remained stable throughout her whole hospital course. So just lessons from this case and some others with the FAST exam. Do a careful FAST. You need to do it efficiently, but you shouldn't go so quickly that you don't see important things, especially subtle fluid. And when you see clues, like you see intestine, then spend a little more time, look a little bit more closely. Find the uterus in females, because behind the uterus is where you're going to find the fluid. And then one other thing, if you see outline of the intestines, that's probably because there's fluid there, making it more easy to see. So look more closely. If you see bowel, there's probably fluid. And then take a look at the spleen. It's easy to see it in a couple of quick views, and look for that normal homogeneous crescent shape. If it's heterogeneous or too large, then that might be a clue that there's clot and other injuries around that spleen. And then just a few other lessons in general about trauma patients and FAST examiners. Sick patients, they can compensate for a while. And sometimes they have things distracting them, like they're anxious, so they have to pee, or they're intoxicated, or something else is going on. Especially if they're young and healthy, they can compensate for a while before they really show evidence of shock. The FAST exam adds to your history and physical, which is the only other big tool you have at the bedside, and your primary survey, and can help you make better decisions and ultimately better care for your patients.